last one. And it's my pleasure to introduce Fabio Di Bello, distinguished expert in education and digital innovation. And as I've learned yesterday evening, he's teaching medical students AI, which is fascinating to me, and I think it's the future. He's currently a senior education manager at Willy. It's my pleasure to welcome here, and he's gonna talk on AI tools, where can they benefit in the management of our patients. Please welcome.
Hello. Well, thank you for inviting me. Thank you, IBSA. Thank you for spending the time. And this is the last presentation of today's session. I'd like to ask you whether or not you have ever used or systematically used artificial intelligence in your daily clinical activities. Great. How many of you use generative AI, like ChatGPT, chatbots? Great. How many of you are engineers? Nobody. So I'm the only engineer here in this conference, and I, feel a little bit bewildered. But I'm used to basically teach something kind of hard, like the mathematics behind artificial intelligence, to faculty of medicine students. So I hope I'm gonna just try to provide you with some mind-shaking innovations that might really change the way you manage your patients, change the way scientists and researchers, come up with innovative treatments for osteoarthritis. So my colleagues before have already shown you what are the difficulties of the management of osteoarthritis, the problems with symptoms, the problems with finding a cure that is still elusive, it doesn't exist, the burden on the healthcare system, okay? And I'd like to basically show you how important it is to leverage artificial intelligence, and particularly generative artificial intelligence, in the osteoarthritis management care. So what I'd like to ask you is, what is generative artificial intelligence? Well, probably you're all aware and you're familiar with machine learning, right? Well, generative AI is a subsystem of machine learning and artificial intelligence that basically is capable of creating new original content. How does it do it? So GPT, generative pre-trained transformer, transforms text, video, images, data into mathematical codes. That's why it's called transformer. So it transforms everything into vectors, into geometry and statistics. And basically it learns from a huge training set, it learns the patterns, the hidden patterns between the data. And so generative AI is capable of creating something completely new given a prompt that you enter. What has it got to do with osteoarthritis? Well, generative AI can, for instance, augment the data and synthesize huge volume of data. Now, you know that there are problems in getting images, medical images, MRI scans from patients all around the world. So generative AI can be used to create synthetic data that might eliminate possible biases that are hidden into the training sets and that might affect the performance of the deep learning algorithms. Of course, generative AI can help you personalize your treatment plans. We talk about personalized medicine. Here we go. That's a real opportunity. So you can basically create a tailored, customized treatment plan, even exercise routines based on the characteristics of your individual patients. And then we are talking about prediction and simulation. Generative AI is capable of help you predict, for instance, the likelihood of progression of a certain disease, or the likelihood that a person might develop osteoarthritis long before it actually does. An example, we talked about data synthesis for research and training. In osteoarthritis research, as I said before, the biggest challenge is accessing limited data sets, especially when it comes to medical images. So we use GAN, generative adversarial networks. It's a specific type of generative AI that is capable of creating synthetic X-rays, synthetic MRIs of joints, for instance, that look remarkably similar to real images. So the augmented data significantly improves the accuracy and the robustness of AI models that are being used to diagnose and monitor OA progression. Another important element is simulating clinical trials. You know how difficult and how long it takes to run clinical trials, especially when you come up with a new molecule. So beyond imaging, generative AI can be used to simulate clinical trials data. And this allows researchers to explore different treatment scenarios, predict outcomes, optimize the trial designs before conducting expensive and time-consuming real-world trials. And this can accelerate the development of new therapies and potentially reduce costs. So, one of the most promising applications of generative AI is creating, as I said before, personalized treatment recommendations. And how it does it is it analyzes the data of the patient, but which data? What kind of data is necessary to really personalize treatment plans? Well, imaging data, the medical history, the whole medical history, genetic information when available, lifestyle factors, what you eat, what you think, what you say, how you move, how you walk, everything must be taken into account. Everything must be analyzed, okay? And again, the problem here is that sometimes we have access to the clinical data. We don't have access to the non-clinical data, to the lifestyle data that are important for these algorithms to work efficiently. So we talked about predicting, and we talked about two things: predicting the disease progression. So I want to basically forecast how long it will take for you to develop the symptoms or to worsen your symptoms, so that I can plan an operation, or I can predict the likelihood of success of surgical intervention on you, like for instance a knee replacement. What will be the rate of success for you? Not in general, but for you, given your individual characteristics. I know you are all clinicians here, probably some of you are researchers as well, but AI can be used to accelerate the drug discovery. That's the typical workflow, okay, to produce and to come up with a new molecule. Well, drug discovery is notoriously expensive. and time-consuming. Generative AI offers the potential to accelerate this process by designing and synthesizing new drug candidates that target specific pathways involved in osteoarthritis. And these models can generate novel molecules with desired properties. So you really engineer the proteins. And those proteins can be engineered to make sure that they bind affinity to a specific target protein. And once that candidate molecules are identified, generative AI can be used to predict their efficacy and safety through molecular simulation. Again, you know, computational power becomes more and more powerful, and we are now capable to simulate how a protein or how a molecule interacts with all the other molecules and bacteria in the entire body. So you don't actually need to go through the entire process of trialing. But let's come to some concrete examples. So I chose 4 examples to show you what, in practice, AI can do. Let's start with this one here. That's a study published by the way, I provided the link to PubMed if you want to have access to the full text. But basically, that's a study that regards the use of AI-driven MRI analysis for early osteoarthritis detection. So I'd like to ask you, do you think that AI will be able to diagnose and interpret medical images better than a human radiologist? Okay, so you are quite optimistic. Well, in this case, you can see that the AI models, you know, obviously the researchers at Stanford use CNN, convolutional neural networks, and they enhanced the MRI images, and they were able to detect early cartilage degeneration before it was visible to a human radiologist. So that's the whole point. Make sure that you don't miss little nuances that can be an indicator of an early indicator of a disease progression. And you can see here that clinical trials showed over 90% sensitivity in identifying early stage osteoarthritis, already surpassing traditional radiographic analysis. That's another example. Now we talk about chatbots, okay? How chatbots can be used for rehabilitation programs. And here there is another study, and by the way, it's coming from Catalonia. We have the professor, Giuseppe. Probably you know about this study, but what happened here is that Microsoft AI collaborated with Harvard Medical School to develop a motion tracking AI system that uses computer vision to assess gait abnormalities in osteoarthritic patients. So patients wore smart sensors, probably you have seen those sensors that you may wear. And what happened is that those patients who wore smart sensors that collected all the movement data, and basically this data was being used to personalize and correct real-time posture, gait, and muscle engagement to prevent further joint damage. So the results showed a 35% improvement in mobility and higher adherence compared to traditional rehabilitation. Another example is patient education. AI can be used to better educate patients and therefore have a better management And this study from Mayo Clinic and IBM Watson, Mayo Clinic implemented an AI-powered chatbot based on IBM Watson to assist patients with osteoarthritis by answering medical questions, providing lifestyle advice, and guiding them through treatment options. Well, over 80% of users reported improved understanding of their condition, so more awareness, leading to better self-management and reduced unnecessary hospital visits. Finally, we talked about predictive analytics, predictive AI models. That's an example of predictive model for knee replacement surgery outcomes. So, University of Oxford used Google DeepMind algorithms, machine learning algorithms, to predict the success rate of knee replacement surgeries based on patient data. So it analyzed thousands of patient records, including age, BMI, previous treatments, post-surgical outcomes, to predict the likelihood of post-surgical complications. Well, again, in this case, the model achieved 88% accuracy, allowing surgeons to make more informed decisions about surgical candidacy and post-operative care plans. Well, we talked about the advantages. It all looks wonderful, of course, but there are some issues here that must be tackled. As I already told you before, the problem of the bias in the training set is still to be solved. Yes, we can create synthetic data, but synthetic data cannot fully replace real-world data. And that has got to do with privacy or privacy. The privacy laws in China, they don't have these problems. They are in a better position than us. They have a centralized repository of clinical and non-clinical data, so they don't have the problem of having biases in the training sets. But we do have these problems. There are ethical and regulatory concerns. And of course, the ethical considerations to address, such as, patient privacy. We live in a Western world, data security, and also autonomy. There are also regulatory hurdles to overcome before AI-based medical devices and therapies can be widely adopted. So, who is the responsibility of an agent who makes decisions on his own or her own, or well, it's not gender, but who is taking responsibility? And what will be the effects on our agentivity as human beings when we delegate everything, even decisions, and the elaboration of the personalized plans to an AI that becomes autonomous? So looking ahead, there are many exciting opportunities, in my opinion, for future research. I would want to see generative AI being used not only to increase patient care and patient management, but to find a cure to the disease. That would be the biggest ambition. How can we achieve it? Unsupervised learning is capable of finding hidden patterns among heterogeneous data sets. And again, the opportunity that we have is to make sure that the AI makes a submerged medical knowledge emerge. And that knowledge can be used to finally understand and treat incurable diseases. Not only osteoarthritis, but think of dementia, think of neurological disorders, and some type of tumors, for instance. So that's where I would like to go. And finally, I've got 4 seconds left, so I'm perfectly on time. I'd like to show you an example. The fact that generative AI has just now listened to my presentation and has created a video, a synthetic video of what I said.
Osteoarthritis affects an estimated 32.5 million adults in the United States alone, and its prevalence is growing globally. The pain, reduced mobility, and decreased quality of life associated with OA create a significant...
Okay, so that's just, it was 3 minutes long, but I could have created a conversational podcast using Google DeepMind Notebook LM, where artificial intelligence elaborates anything, presentation, conference proceedings, and generate a podcast where two artificial intelligence talk to each other and make comments on what has been said. So that's a reality. I use it every day, and I hope that can be useful for you as well to, for instance, increase your capability to digest medical literature and help you put medical literature into practice. Well, I'd like to thank you so much for your attention, and I'm here for questions, of course, and demonstrations of anything that you'd like to demonstrate.